Hello, everyone. My name is Dr. Priya Balachandran from Applied Silver. Thank you so much for viewing this poster presentation. Today, I will be discussing with you how inclusion of a novel soft surface antimicrobial technology in infection prevention programs has meaningful impacts on microbial bioburden in the patient and user environment, as well as clinically significant impacts on healthcare-associated infections. I'm sure all of you realize the importance of healthcare textiles as they are recognized as an increasingly important, epidemiologically important environmental surface in the transmission and outbreak of various pathogenic infections in the hospital environment, as well as in various communities. There are numerous studies that demonstrate that inclusion of antimicrobials on these soft as well as hard surfaces in various settings are effective in reducing the transmission of healthcare-associated pathogens and consequently lead to the reduction of associated infections. At Applied Silver, we have developed a technology that harnesses the antimicrobial power of ionic silver and provides a very effective way to obtain residual efficacy across soft surfaces. And this includes all launderable soft surfaces. This poster provides a comprehensive overview of recent studies that describe the impact of infection control bundles that contain SilverClean on outcomes. In the first figure, we look at inclusion of SilverClean and its impact on microbial bioburden loads, specifically MRSA loads, on patient linens. And in the first part of the poster right here, we're looking at items that are in storage where even though they're clean and they're stored, there is a certain population of microbes that are always present and create transmission risks. And on the other side, we see in-use fabrics or patient linens where microbial bioburden was assessed immediately after patients had used the linens and were discharged from the hospital. In both cases, we see extremely significant reductions in microbial bioburden loads when SilverClean residual antimicrobial is included as part of the linen program. In figure 2, the study expanded to include privacy curtains. Privacy curtains are at high risk for transmission and contamination because they typically hang in wards for extended periods of time. So there is frequent contamination due to frequent handling. In this study, we looked at 4 time points, including when privacy curtains came out clean immediately from the dryer, in the laundry where they were packaged, pre-patient use where they were in storage, as well as post-patient use, meaning after they had been hanging in wards for extended periods of time. And inclusion of SilverClean in these programs, again, on these privacy curtains, resulted in significant reductions in microbial bioburden loads. In another study done in a professional athletic facility, we looked at Staph aureus loads on athletic gear, meaning uniforms that were used by athletes, as well as the locker room environment, and saw downward trends with repeated use of the product. Here, we were looking at the impact of firstly, inclusion of SilverClean as it related to microbial bioburden loads on player uniforms, but also whether it reduces the risk of transmission of those same germs onto associated locker room surfaces. And through these studies, we demonstrate that by inclusion of antimicrobial activity on the surface closest to athlete skin, meaning their uniforms and their clothing, not only reduced the risk on the clothing themselves, but also reduced the transmission onto the environment, and over time created a much cleaner environment. And lastly, at the bottom, we looked at impact on outcomes. These were studies that were done at community hospitals where over extended periods of time, we monitored hospital-acquired infections. This included CAUTI, CLABSI, SSIs, and CDIs. And in this graph, we show that over 18-month use period, that there was a 43% reduction in infection rates across these 3 hospitals, with the most significant reduction being in CDI rates. And the SilverClean technology is very easy to implement. It is implemented at the laundry and requires no change in workflow of linen management. And it effectively provides a way to take existing hospital inventory and converting them into antimicrobial inventory, such that you now have soft surfaces actively participating in infection control and providing an additional layer of resistance and of prevention to provide for an overall robust infection control program that has direct impact on patient outcomes. Thank you very much.